Hey there, class. Wow, this has been a really big course. And if you have watched all these videos, I just really want to commend you. This last one will be short and sweet. We're just going to discuss biological therapies. We're going to look at medication, electroconvulsive therapy, and a brief look at surgery. So enjoy. So there are three basic biological approaches underlying psych disorders. Number one is drugs or psychotropic medications. Number two is electroconvulsive therapy. And three is surgery. So psychotropic medications, here's what I want you to know. There's tons of medications. I want you to know these general classes and what they're for and maybe a couple of the names. So the antidepressants are for mood, anxiety, and eating disorders. And an example of this is Prozac. Mood stabilizers are to stabilize the mood, so that would be for bipolar. So remember, bipolar, you'll have somebody will be manic or they'll be depressed. And so we want to stabilize the mood so it's level, and that would be lithium. There are antipsychotic medications. I mentioned Thorazine in this chapter was the first antipsychotic in the 1950s that contributed to the deinstitutionalization. These are for schizophrenia or other psychoses. And so we might look here at Haldol or Risperdal. And then finally, the anti-anxiety drugs. These sometimes overlap with the antidepressants, but these are for anxiety, phobia, generalized anxiety disorder, and panic. We might look here at Xanax, Ativan, or Valium. So psychotropic medications plus psychotherapy. Research suggests that psychotropic drugs are most effective when used in conjunction with psychotherapy. If you have a choice between drugs, psychotherapy, or a combination, you know, it's going to depend, but typically the drug is going to be most effective if you also have psychotherapy. You're generally not going to want to just use a psychotropic medication. Combining medication with an integrative approach, including cognitive, behavioral, and psychodynamic perspectives, reduces major depressive symptoms faster than either approach alone. So just a quick look at electroconvulsive therapy. This is also known as electroshock therapy or shock therapy. If you've ever heard those terms, that's what we're talking about here. And this is still done. And it does look barbaric, but it can be effective as a tool of last resort if antidepressant drugs have not been effective. As I recall, William Styron did electroshock therapy. So this involves a brief burst of electric current to induce a small seizure in the brain, typically used for depression, and I say typically, that's the most common use, but most people with depression aren't going to get ACT. ACT will be used as a last resort when the drugs or psychotherapy doesn't work. It is sometimes used to treat mania or schizophrenia. It is only used after other forms of treatment have failed to help. The antidepressant effects can be short-lived. About half of patients will relapse within 6 months. There can be side effects, such as memory loss. It's really not known exactly why it does treat depression, which is one of the reasons why people are a little bit cautious about using it. And it is controversial because of its early overuse, and it looks harsh. It looks kind of scary. And then I mentioned surgery as well. We're not going to talk in any kind of detail about that. There's a few details in your books, but you can do surgery. Now, sometimes this has gone badly. Lobotomies were very popular for a while and then went very much out of favor. If you'll remember HM, Henry Molaison had his hippocampus removed, and then he couldn't form memories, had no memory. So there are times when surgeries are thought by the population generally to be very helpful at treating particular conditions, but then are sometimes found later not to be helpful. But there are some surgeries that can be helpful to treat depression or other disorders. So take a look at that in your book. All right, what I'd like for you to take from this particular chapter is, this particular video is, I want you to think about antidepressants are for mood, anxiety, and eating disorders, like, and an example is Prozac, mood stabilizers, bipolar, lithium, antipsychotics are for schizophrenia, Haldol, Risperdal, and anxiety drugs are for anxiety, phobia, GAD, and panic. Xanax, Ativan, and Valium are 2 examples, and then ECT. Potential use for depression if nothing else is working. And we don't really know how it works. Okay, thanks so much. I enjoyed my time with you. I hope you enjoyed this class. Take care.